we can see here an action potential arriving at myocardial cells. The action potential depolarizes the membrane potential and changes the configuration of voltage-gated calcium channels. They open up. Calcium has large electrochemical forces, so we have calcium influx. Calcium from the extracellular space moves into the cytosol. It increases the calcium concentration. This accounts for 20% of the increase. The incoming calcium also activates ryanodine receptors, which are calcium channels, in the sarcoplasmic reticulum. Sarcoplasmic reticulum is a calcium store. So calcium will leave the sarcoplasmic reticulum and will move through the ryanodine receptors into the cytosol. This accounts for 80%. So 20% from the extracellular space and 80% from the sarcoplasmic reticulum. So then we can trigger the cross-bridge cycle, the contraction. At the end of the contraction, the cardiac muscle has to relax. So we need to bring calcium back into the sarcoplasmic reticulum and back out of the cell. Into the sarcoplasmic reticulum is achieved by the action of SERCA, which is a calcium pump. Because calcium has a high concentration in the sarcoplasmic reticulum, so it needs to be pumped into the sarcoplasmic reticulum against the gradient, which is why the SERCA needs ATP. And we can also bring calcium back out of the cell by the activity of this exchanger, NCX. This is a sodium-calcium exchanger. Now, at this point in time, I would like to note that the activity of this exchanger depends on the activity of the sodium-potassium pump, but I will discuss this later. Here I have a summary for this part and the previous part, for the excitation-contraction coupling in cardiac muscle. And now I will discuss the effect of the sympathetic system on calcium levels and cardiac muscle contraction. In this slide, we see three graphs. The action potential in black, followed by the increase of the calcium concentration, this is the graph in blue, and briefly after the increase of the calcium concentration, we start the contraction, which you see here in red. And now I will talk about the action potential. I have discussed the action potentials in myocardial cells in the previous part, and I will dedicate another part to this later on. This phase in the action potential in the myocardial cells is referred to as plateau. This is the result of calcium influx. For almost 200 milliseconds, this is physiologically crucial because we need to contract the atria first and then the ventricles. We need some time. Okay, now the force of contraction depends on the calcium concentration inside the cell. And the contraction can also be prolonged if we prolong the high concentration of calcium in the cells. So adrenaline stimulates voltage-gated calcium channels by activating a protein known as pKa, intracellular signal, which in turn activates the channel. Medical implications. I have at least two. Cardiac glycosides. Now these inhibit the sodium-potassium pump. Remember, the activity of the sodium-calcium exchanger depends on the activity of the sodium-potassium pump. If we inhibit this pump by cardiac glycosides, this indirectly reduces the activity of the sodium-calcium exchanger, which you see here and here. So this results in longer increase of calcium concentration inside the cells. Eventually, this increases the force of contraction. Therefore, cardiac glycosides improve cardiac output in people who have heart failure. Can also apply calcium channel blockers for many different medical purposes. One of them is to reduce the afterload. we have afterload, we also have hypertension. Calcium channel blockers decrease blood pressure in patients with hypertension, among other cardiovascular diseases. Also, they can be utilized to combat some forms of arrhythmias, but I will dedicate a separate part. Calcium in skeletal muscles. Here, again, excitation-contraction coupling, which I discussed in details in a previous part. I will now focus on the interaction between voltage-gated calcium channels and ryanodine receptors. In the resting state in skeletal muscle cells, repolarization, we have the voltage-gated calcium channel directly coupled to the ryanodine receptor in the sarcoplasmic reticulum. The incoming action potential depolarizes the membrane potential, changes the conformation of this calcium channel, voltage-gated, also known as DHP. This results in opening of the ryanodine receptor in the sarcoplasmic reticulum. So now calcium can leave the sarcoplasmic reticulum and move into the cytosol. This increases the concentration of calcium in the cytosol and triggers the contraction.